Hello, my name is Dr. Michael Sheps. I'm at Pacific Coast Sports Medicine. A few months ago I introduced eField to the clinic, and it's been well received with the patients, especially the outcomes with the patients, but also with the other providers have looked at it as an alternative modality to send their patients to get rapid, immediate results and accelerate the rate of healing. So eField is a great alternative or even a primary modality for cervical pain. You can treat trigger points. This is the 2.5 Tesla handpiece. You go in above the traps, you can get into the suboccipital. Those patients with the chronic trigger point at the upper trap, excellent for that. Discogenic pain, acute cervical acceleration, deceleration injuries, get tremendous relief. I like to go into the upper part of the thoracic spine, up the spine, base of the skull, the suboccipital muscles, and we do 20 minutes hands-on treatment using the 2.5 Tesla handpiece. For thoracic spine, you can use the surgical arm, place it on the small of the back, either in the seated position. If the patient's comfortable prone, put it in the thoracic spine. I do two. I split the treatment up, upper thoracic, lower thoracic. People get a tremendous amount of relief. Our patients that have the scapula winging, all of our patients seem to need to retract the scapula. You could initiate some muscle movement and move the scapula, and it feels great with the 3 Tesla handpiece. Conditions that I treat are typical chiropractic indications, but also physical therapy as well as orthopedic. Having 10 orthopedic surgeons in the clinic, they looked at me as an alternative to performing steroid injections or physical therapy. Patients that are not quite ready for physical therapy, they have been referring to these types of modalities that I use with the Zimmer products, including laser and eField. Typical conditions that I treat are, of course, musculoskeletal. Very good for garden variety, low back pain. Fantastic for neck pain, acute and chronic neck conditions. Shoulder, excellent modality for shoulder, elbow, wrist. Fractures that are healing by non-union. It's great indication for that. Knee pain, all kinds of tendinopathies of the ankle and foot. Can use it in addition to other modalities to augment the treatment with laser, chiropractic manipulation, physical therapy. With the emField, the feedback from the patients is quite positive. It's very comfortable, it's relaxing. The patient feels like they're getting a modality that penetrates deep enough to get some problems down in the joint, deep muscle. With the eField, patients find it very relaxing, sometimes even falling asleep during the session. And after a treatment, they don't mind repeating the emField, although it typically is a cash modality. Patients are certainly willing to pay for this modality because the outcomes are good. The relief is immediate, and we also see some sequential improvement, incremental improvement with treatments for several treatments before it starts to plateau. So good outcomes, comfortable, safe and effective, no side effects. We like it.